Hello, thank you for joining us today. This is the Quality Improvement Center for Collaborative Community Court Teams REDCap webinar. We're excited today to feature the REDCap system. This is really an opportunity for us to be able to share how to use this system and to sustain it past the QIC grant. So really thinking, we often talk about sustainability, but this is really an opportunity to take a concrete step to sustain a lot of the work that everybody's put into building evaluation capacity over the last 2 years. So really quick, just a quick acknowledgement. This webinar and this entire project is funded by and supported by the Children's Bureau and also our partners, and which is AHP, the National Center on State Courts, the ABA, and the Tribal Law and Policy Institute. Today we'll be featuring Terry Tobin, our evaluation director, who is from Advocates from Human Potential. With that, I will pass it to her. Thank you.
Thanks, Sasha. Hi, everyone. Welcome, and thanks so much for joining today's session, where we're going to learn a bit more about REDCap, about how we're all using it for the quick evaluation, and how you might be able to use it to benefit your work now or after the grant ends, as Sasha mentioned. So I'm Terry Tobin. I work with Advocates for Human Potential, or AHP, and I'm the Director of Research and Evaluation. We're headquartered just a bit west of Boston, so that's where I am coming from, where I am today. I've had the pleasure of meeting many of you in my role as the Evaluation Director for the Quick Initiative, and so I'm excited that you can make it to the session today. Again, thanks for joining. Today is going to be a little different than many of the other webinars we've been doing with Quick, in that it's more of an informal tour of this tool, how our project looks in it, and examples of ways you might be able to use it. So pretend that we're sitting around your conference table and just walking through the computer and saying, this is what it can do, this is how you might be able to use it. It's more of that kind of a session today. I have to start with a few disclaimers. I don't work for REDCap, and I'm definitely not an expert in it, but I am working in it a lot and end up learning more every day. So I'm coming today to just share what I know and to talk more concretely about how you can extend what you've been doing in Quick and how it might work for other purposes that you have. To tell you a little bit more about the experience level, we are currently running about 8 projects in it. They're all research and evaluation projects, and they range from the very simple to all the way to the other end of the spectrum to what REDCap staff describe as probably the most complex that they've seen done in it. So we have a whole lot of different things going on in it. The other disclaimer is that today's discussion will be a very minute tip of the proverbial iceberg. It's a tool that has a lot of features and capabilities, and tackling it, as you might imagine, would take much more than the hour we have today. But hopefully, as we zip around the system, it'll give you a better idea to see if it's worth exploring further for the work that you're doing. I am going to be toggling back and forth between sharing the slides and sharing my live system to demo the different features. So thank you in advance for being a little patient as I try to make those transitions quickly. Also, another note that the slides that you receive later do have screenshots of most of what we'll be looking at live, so that you can refer to them later on if you'd like to, just to refresh yourselves. So let's start by getting a sense of your experience with REDCap. We're going to ask a quick poll question.
All right, the poll is now open. So the polling question is, have you worked with REDCap outside of this QIC project? Yes or no? All righty, looks like most of us have responded. I'm seeing about 20% say yes, and then 80% say no.
Oh, great. Thanks for sharing. That's really helpful to know. So our goals for today, let me just advance here. Our goals for today are to introduce the tool and some of its key features and capabilities. Some of you who may have experience will know some of that. Discuss some advantages to using it, as well as limitations and cautions that are important to consider. We'll cover some of the highlights related to the technical and cost details, basically details about how to get it, and take a quick tour around the system using our quick project as the example. We'll also show how we've built in a few extras just to give a sense for how you can modify it. Point you to some resources where you can learn more if you're interested, and spend time on any questions or ideas you might have as we break at the various sections of the discussion. We have some time built in for that. So let's start by giving a brief overview of what it is, and then we'll launch into why you might use it. Again, depending on your role in QUIC, you might already have a general sense of what it is, but I'm going to dive deeper into that first to get everybody on the same page. So it's Research Electronic Data Capture, or REDCap. It's a secure web-based software platform used for building online surveys and databases pretty efficiently on a fixed budget and securely. It was created in 2004 at Vanderbilt University, where it's still supported, in fact, and it was supported in part by a National Institutes of Health, or NIH grant. So the software is also now supported by a global consortium of nonprofit organizations, and it's really used for a wide range of data collection needs that we'll talk about. Later on, when we talk more about how to get REDCap and the consortium in particular, you'll see that the consortium is composed of thousands of active institutional partners in over 100 countries who use it and support it in a variety of ways. Actually, the current count is that it's being used by more than 3,200 organizations in about 130 countries. So while there is Vanderbilt and the consortium, it is important to note that each REDCap system is independent. So every consortium partner site personalizes their system, manages it, hosts it, and we'll talk more about that a little later in the technical details. One very nice early thing to note about the tool is there's a tremendous amount of resources available online about it. Many are built into the software, and you'll see later as we go through that it, for example, has instructional guidance and prompts throughout the system and throughout a data project's life cycle. So it has that piece, but there's also a ton on the web. For example, they have maybe 24 informational REDCap videos that can help you get started and really gain a better understanding of the application and all its functionality. The link is there on this slide. We also have a resources slide at the end of the presentation that has a few links on it. Aside from what REDCap does directly, if you Google it, you'll see that many of the consortium partners, including many academic institutions, have online materials too that they share. So there's really a lot available to help all of us learn more. And that's a very nice thing. So it can be used from anywhere, at any time, and on any device. Tablets, smartphones included, really anything where you have internet access, and you can use it to capture pretty much any type of data and for any purpose. There's also a mobile app that allows for offline use that you can then connect later and it uploads. While it was originally developed and is really geared to support research studies, it was also designed to be pretty neutral. So that's why it can support any type of work. You could put administrative tracking sorts of data in there, event registrations, feedback surveys, and much more, which you'll see as we go through. Some of its key features that we're going to talk about today that I think are of particular interest to our group here is user authentication and role-based security, where you can really control you can control very specifically who can access and see and do what. That can get very specific by user. It also has real-time data validation and entry checks. It has very extensive auditing capabilities, and it uses MySQL to hold all of that together in a relational database. It also has some internal statistics and reporting capabilities that are nice, where you can see your data on demand and in real time. So you can create custom queries that generate reports that you can just view on the web page, or you can also download those reports. You can download the data and export very easily to common statistics packages like SPSS, Stata, etc. You can design your project to use a number of different things. First, surveys, and they have a couple of features to note. They can be anonymous or identifiable, and I think many of you who enter data for QUIC do use the survey route, so you may be familiar with that interface. The surveys also have features where it allows you to automate them to be administered on a schedule, so maybe every month or every 2 weeks, for example. So the second type of project uses data entry forms, and that's where you're logged in as a user. So some of you access your QUIC data that way and submit that way as well, so you may be familiar with that. There are a couple of ways you can do this. In that one they call classic, where you're using one or more forms or instruments and they're only used one time, or a longitudinal where you have multiple forms and you're using them at multiple events over time. There's also a study calendar for tracking all of that. And the third type is a combination of both of those two, and we definitely have all of that going on in QUIC. So we have the number 3 type listed there on the slide. So many of you have seen it all in motion. The longitudinal example, a couple that we have in QUIC that you might remember is the NICFAS we're asking for at enrollment and closure. So that's a longitudinal one. And the IACFD is at enrollment and closure. So those are some examples of that. I'm going to switch now to sharing my screen to help with this introduction. So give me just a minute to go into my REDCap system. So here I'm going to start on my home page. This is a good spot to highlight some of the built-in learning resources that I mentioned just a few minutes ago. So for example, you can go to the training videos page when you're in the system, also available to you on that website that we mentioned and listed. And here's just an example, a summary of what each video does and watching it. And there's quite a library there for that. It also has a pretty extensive FAQ section available in there as well. After the home page, we have the area that lists your projects. Another example of the instructional guidance that it has throughout is, so for example, you can see read more, and it tells you a little bit about what you're going to do on this page and what's possible. So here, REDCap projects, that's what it calls its web pages. So they're simply web pages that you build within the software and you use them to enter data. It happens to be that ours are organized around actual projects as well, but that's how REDCap uses the terminology. You can see I currently have access to 7. There are these public projects down here are demos that you can use that are provided by REDCap that are public. But here in my projects here, I have access to 7. And there's a brief summary table of their characteristics. So for QUIC, you can see that we have over 1,100 records, 4 forms, 19 surveys. You can just get an idea of highlights of the project. So if I click on our QUIC project to open it, we'll see the typical project layout. I tried to make the screen a bit big so that you can see, but that means I just need to scroll around a little more as we look at things. So here we have 2 main areas in each tab. The project menu is on the left. I'll just scroll down here a little. I'm actually going to collapse these before we talk about them. So you have the project menu on the left, always visible, and the workspace on the right. So I'm going to walk through the menu quickly first to highlight what's in the main areas there. So you have one for project home and design. and that's where you set everything up. It comes with, as you work to set up your project, there is a data dictionary that gets created, a PDF codebook that automatically gets generated. But so you do all of your work here to get everything going. Then there's data collection. I'll just expand these. We'll talk more about them later. Project management or applications. This area has many built-in tools, and what it helps you do here is control how people interact with the project. So it helps you manage both the project and your data. It's important to remember that if you do decide to adopt REDCap, you have complete control, so you can explore and test all of these features to see which ones best suit your needs. But there's a lot there to help you with everything. Then there's a section for reports. You can see we have a number of them set up, and then a section for help and FAQs and video tutorials. So that's a quick walkthrough of the left menu. I'm going to circle back to project management for a minute, or applications, and highlight one that I think many people will be interested in, and that's user rights and DAGs. DAGs stands for Data Access Groups. So user rights, it allows you to grant users access to the project and to manage the privileges of those users. So for example, I'm going to scroll down a little bit here. Site leads who have user access are listed here under the role of site lead. And you can see here that each instrument, whether it be a form or a survey or how it's configured, you can get very specific with each person to say they have no access, they have read only, they have view and edit, or they can edit survey responses. So all of that can be configured at the user level, which is nice. So when they log in, they can only see specific things. They can only edit specific things. Another feature, let me just go back to the left-hand menu. Another area in the left-hand menu is reports. And I'm just going to show you a sample report. I'm going to scroll through all those screenshots. So reports are searches. They are repeatable real-time queries of your data set. So they can be run at any time, and they can include basic analysis, statistics, and charts. Some examples are shown here. And while they aren't very fancy, the beauty of them is really that after you set them up, they can be run in real time at the push of a button. So you can be in your system, hit view report, and see all the latest information that has been submitted data-wise. They can also be easily downloaded, for example, to include in a PowerPoint or a report that you may be doing, or a project newsletter for dissemination. So unlike Excel or other things that that folks might be using, this does have some nice statistics, basic descriptive statistics, and reporting features inside of it. For more robust analysis, if you need it, it can be downloaded, exported in multiple formats. It basically creates all the files that you would need for analysis in those statistical packages that I mentioned earlier. I'm going to go back to REDCap and talk a little bit about the Project Setup tab. So here in QUIC, in the Project Setup tab, this is where you do everything, and it walks you through step by step of how to get something going. So here you see I completed steps 8 of 8, which is good since we are deep into this project. But it walks you through setting up everything related to the main project settings, designing the instruments, and enabling your surveys. Lots of features here, and we'll cover a few later. Defining events, optional modules, any project bookmarks, testing, and then moving it to production status. So all of that happens there. Data entry mainly happens all in this area over here called data collection. Data entry can be either while logged into REDCap or not, and I think for those of you working in QUIC, you've seen that. You can either click on the link or you can log in with your username and password. But using it as a database is when you means that that's when you're entering data while logged in as a project user. In contrast, using REDCap for a survey really allows you to get to the web pages and enter data without logging in. So I'm going to go to our data collection section here and add a new record so that you can see what data entry looks like when you're logged in as a user. So add edit records, and I'm going to add a new record for this. And here you can see it creates a record homepage. So this is the area where everything for this new record is showing in terms of what's expected. So if I start with the first form, which is just the record ID form to get everything started, I can open it in this user view and start entering about who I am and which site I'm with in terms of submitting data. Oops. And I can go to the next form for this case that I'm doing data entry for, and that's enter the case ID, the date received a referral. It has all sorts of things around that in terms of either entering or using a calendar or using the Today button. If fields are required, you can choose for it to show in red, must provide value. It also gives you a history widget, which shows you all of the history of all the data entered for that particular field for that case. So if you click on that, you will see that I entered, after you save it, you will see that, that I had entered that date today. So that's how you enter data, basically. You can, that is the user view of what you see, more like a data entry interface. If you want to use the survey, which you all have seen in QUIC, and you do via the link, this is what it would look like. That same form, but more in this survey view. Let me just go back here. So hopefully that helps you get a quick sense of what REDCap is. And now let's just consider why you might want to use it. The idea that sites might want to use it came up last spring. I was actually on the site visit with the Douglas, Georgia folks and showing it to them because we were talking about how we were going to move away from doing the PSRs in Excel and move all of the evaluation data collection into this system. And when I was there on site and showing it to them, again, around the conference table, the light bulbs started going off for them that really they started imagining all these other ways that it would help them do what they do. So we thought that might be the case for other sites as well. And that's how this idea came up to be able to share it this way. So a big thanks to Douglas for starting us off with this idea. So I'm going to start by highlighting some advantages and then come back to focus on a few, but I'm going to run through a quick list. So the software is free. It's designed to be secure. It's relatively intuitive and easy to learn, accessible. It's becoming more universal with so many joining the consortium that I mentioned before. And it has a ton of features that allow for really efficient and flexible data capture and management. You can create and design your project rapidly using secure web authentication from your browser. So there's no extra software required. You can do it from any computer once you have it. It has a great user interface that makes it relatively quick and easy to build a project. You can also use Excel to design your forms and then upload it into REDCap. All of the different ways it allows you to do that stuff really makes it pretty fast and flexible. And they suggest that you can go from conception to a production level survey or database in less than 1 day. I would say that's definitely been the case in my experience, depending on the complexity. Certainly, the quick structure took more than 1 day. But if you're trying to get something up and running that's pretty simple, I would say that that's possible. It's great for forms that you might need or that you currently collect, but maybe you keep them in paper form or in an Excel file or in some other way that's not all that helpful for seeing your data quickly, seeing it in real time, being able to capture all the things that it can do in here. So for example, you could use this to collect simple demographics or other enrollment and case closure details, manage your operational workflows. You could set up longitudinal forms where you may be collecting or recording data for the same family or the same person at multiple points over time. For example, like court reports or your analysis results, and we'll see some of those examples later. The screen layouts are pretty clear and simple to navigate. As we go through today, you'll see more of that. It has some interactive editing features, for example, range checks, data type checks. So for example, if you can set it, you want a phone number to be in that, in a particular field, you can set it so that it won't accept anything that's not in phone number form. It has valid date checks, so you can set it to not do anything before the year 2000 or something in a field, and it has branching logic so that skips and branching so that you only bring up the fields based on certain answers. There's also a data quality module that supports reporting on problems with data consistency across forms. There's an audit trail for tracking the history of data entry and revision, and it includes a library, access to a library where you can get a number of different standard data collection instruments. So for example, if you wanted to use the SF36, RAND's SF36 instrument, it's available in the tool, and you wouldn't have to build that out. You just import it into your project and start using it. So that's all great stuff. I'm going to pause for a minute and go back to the top of this slide where I mentioned it's free, and I put there low to no cost. There is a big caveat that I just want to mention. So if you go the free route, which it is available, the software is available free to nonprofits, all the IT support and infrastructure has to be provided by your own organization's internal IT department. If you're not able to do that, you have to explore, but you still want to use it, you can work with Vanderbilt to explore their data hosting services. That's the only two ways that REDCap can work. You either host it and manage it yourself with your own IT and infrastructure, or you work with them to use their data hosting services. So just as an example, AHP is not a nonprofit, so we weren't able to go the consortium route. We weren't able to join the consortium and use it for free and host it ourselves. We had to use their Vanderbilt's data hosting services. And to give you an idea about that, in case it is something that you might need, that costs about $200 a month. And they do all the hosting, and they do all the management in terms of storage, but also if you want to make a change and you're already in development, they review it to make sure that that change won't result in a loss of data, all of that sort of thing. So you get a lot of service for that, $200 a month, but I just want to highlight both ways of being able to get it, and we'll talk more about that later. So it has much more than we can cover in our 1 hour together. So hopefully this helps to give you an idea. Here are some more features that I hadn't mentioned already. Some that I'll mention on here, you can save your data collection instruments as a PDF to print. I think when we all trained on it for QUIC, we showed you how to do that. So if you had entered information for a family, you could get a PDF of your version of out and be able to put it in your files or save it to your files. You can also print paper versions of forms that you could then distribute and then use this as a data entry system. So it has that capability. I think most everything here we talked about. There is a send it a way to send files to others securely noted here. They uploads and sends files that may be too large as an email or contain sensitive data, so it has that. It has piping abilities, which we'll see a little more in a minute. So anyway, a lot of great stuff to be able to use for anything that you need it for. So most of the reasons here in terms of advantages are pretty straightforward, and the ones that I've mentioned. So I'm going to focus a little more on the last one showing on the slide. It's really unique to this particular project in that it has all that great stuff as part of the software, but in this particular situation, it already has the quick evaluation infrastructure and your own site's data already. So if you got it in further down the road, you could import our structure and your already collected data, so all the families that you have entered data about, and you could import it into your own system. You could modify it, and then you could continue to use it. So I'm going to show you a little more about what I mean about that. Let me just go back to a certain area here. So it has the capability, for example, this first option, export the entire project. So at the end of this grant, we could provide you this XML export that has all your own records, just your site, all of the instruments that we've been using, all of the fields, everything about it, everything you've been doing in there already would be downloaded as a single XML file. That file then can be uploaded on the Create New Project page in your own system, and then you could work with it. I'm going to show you that as well. So for example, I just did it into, so say this is my project here at AHP, right? And say you developed a new project in your system and you called it for something else, and we're now in your new project. Let me just go there. Within, I don't know how long it took, maybe 10 minutes, I was able to import all of these instruments listed here. So here's our place where we get ROI consent, IACFD for the adults, for the children. I added some things. So now, for example, say I want some of the quick evaluation instruments like the IACFD with demographics and enrollment information, but I also want a place to put a plan of safe care. I wanted to keep the ACEs instruments that the quick evaluation is using, and I wanted to keep the NCFIS, but I also wanted to add a place where I can stay in contact with families around by sending them birthday cards for engagement purposes. Sorry. I also I took the quick evaluation stuff and I decided I wanted to add a place here for court reports. Where I would enter court reports or where I would enter your analysis results. I'm just going to open these real quick. So here's a place where I could enter a urinalysis results every time it was available. And I could pipe in, I mentioned piping before, I could pipe in earlier results that were coming in. And then I could log the new information, save and exit the form. And then when a new urinalysis report is in, I could add a new one and have all of that history showing at the top as well as a place to add new ones. So this is an example of where I took the existing quick evaluation project. I imported it into a totally new project, pretending I'm a site who's just wanting to start using this for myself. I kept the instruments that I wanted to keep using, so the IACFD, the ACEs, the NCFIS. I added other instruments that are completely unique to my site and that weren't part of the evaluation. So that's just a quick example of how you could do that. So that's unique to this project, right? That it's not just about what REDCap can do and how rich its features are, but we can provide you all of that infrastructure instruments and your own site's data, and you can get started with that when if you decide to adopt it and use it. I'm just going to go back 1 second. So that's a lot of really good stuff. That was all on the advantage side, but there are also some important cautions or limitations that I just want to mention. They can get pretty technical, so I'm just trying to highlight them, but if you're thinking of adopting it, you would want to really dive into these in more detail. And they include something I mentioned before, but want to reemphasize: all the IT support must come from your own organizational IT department. You can't contract or use unpaid volunteers or use any third-party software vendor. You can't use anybody else. Per their license terms, it all has to be internal employees who are working to support the IT requirements. Although it does have a lot of automation in terms of like emails and scheduling and surveys and reports, many of those tasks do still need manual intervention. So, you still have to do some stuff on your own. If you want to design a form or a data entry module, which is completely free format with no editing, or which is kind of risky because it has no sort of control in it, it won't prevent you from doing so. It lets you create whatever you want to create. And so that's just a caution. It also doesn't prevent people submitting data that's out of range. It'll provide warning messages regarding out of range values, but these can be overridden and you can still submit. So you all may have experienced some of this in QUIC, where we've reached out afterwards to check on maybe incorrect case IDs or client IDs, or maybe birth dates for adults with this year in the date, things like that just don't make sense. It didn't prevent you submitting those, it just warned you at the time. There's also not a participant portal, so like your clients don't log into this area. It's not like an EHR in that way, a health record sort of system like that. And they do also, in addition to IT staff figuring out how to host it and run it, they do recommend internal administrative support. That really varies based on how much you use it and how much is in there, but you need somebody to help the end users with any problems or experiences that they may need help with. So those are some cautions. You can try it. They offer a free 1-week trial account. We have the link for that in the end of the presentation. This is just a quick, and it's actually up here too, sorry, at the top right of the slide. And you can learn more about it before you decide if you'd like to go ahead with it. So I know folks are interested in security details, so I'm going to talk a bit more about that, and then we can break for questions. So the cautions are at the top of this slide too. It's very important to note, again, each REDCap system is independently maintained and supported, so its security, while it's designed to be as secure as possible, it really depends on how your site installs it and maintains it. It's a web-based application. It's installed by each organization, so your infrastructure and environment in which it's installed is really critical to security. Also, no matter who's hosting it, project users manage, grant, and restrict access. So when I was showing you user rights before, if I give 50 people access to the project by setting them up with user accounts, and I let them see everything and do everything, then it's not very secure. But that's not related to the software. That's related to my project management of it. So earlier I mentioned, for example, data access groups or DAGs. So it has the capability to say, this person A, I'll use Gabe, Howard, and Douglas as an example. Gabe is associated with the data access group for Douglas. She can, when she logs into the system, she can only see Douglas's data. So again, making those sorts of assignments and connections and access details are related to security. But aside from those cautions, it does have a number of features that support security, which are listed here at the bottom, and I'll just briefly mention. So, and you all experienced some of them in terms of, especially the first one, authentication. So it's required for database access. To get into the system, you have to have a login and username and password, and it uses a two-factor authentication system. I know that drives some people crazy, but it's for the security piece. It also has an auto log out if you haven't been, it times out. There are user rights, as I mentioned, where data access is based on an individual's role on the project and how you set their privileges. Logging an audit trail where it logs all user activity, everything that happens in there from a user perspective, every page that's viewed by every user. There is a log about all of that. It has data export and data identification automation where, for example, you can do date shifting. It will automatically remove any free-form text fields, dates, or fields that you've tagged as identifiers. So, for example, PHI, it'll automatically strip all of that from the files being exported if you choose that option. And it has related to data storage as well. So the consortium website that I mentioned earlier has a lot of detail about this. I'm really just giving you a brief summary. So for example, here on their website, you can see this brief bit about HIPAA compliance. So for example, it can, before you export for analysis, you can create a limited data set or a safe harbor data set where it removes the 18 identifiers that are considered part of HIPAA compliance. It has a setting to do that. And it talks all about all of those technical details there. You'll really want technical staff and leadership to review all of this information pretty closely to see if it can be installed and maintained as you would need it for security and other purposes. So that's really important. So I just ran through a lot of details, so let's just take a break to check for questions before we talk more about how to get it. Any questions that you'd like to type into the chat box?
Thanks, Terry. I'm not seeing any questions come in right now. Well, we can wait a second and see if anybody has any questions.
Okay.
I don't believe the lines are not open, so please use the chat, the questions function to ask questions.
I know we have a lot to cover, so there'll be other opportunities. I'm just going to go ahead to the next piece. So let's say you do the free 1-week trial and you decide that you'd like to move ahead. You may be wondering where to start. So it all starts on that projectredcap.org website that I talked about, and it's actually linked here. They advise you to go to that website and start by first reviewing. You can start by reviewing the partners page to see if there's a REDCap system already available to you. There are a lot of organizations that are already a part, so it's possibly you or partner are have access already. But if you're not there, the two other options I mentioned. Nonprofits can join the consortium. There's a license agreement. In that case, you're independently responsible for the installation, maintenance, user support. And then the second option is to use Vanderbilt's REDCap system, and that's where you pay the monthly fee. One thing I didn't mention about the monthly fee, the first 3 months are free under that scenario. You don't pay the $200 a month fee during the first 3 months of development. So if you think you might like to go the consortium route, you can learn more about it at that link. There's a lot of resources there. That is the option where it's available, the software is available at no charge to nonprofits. Joining requires the submission of a standard online license agreement. It's not open source software, even though it's available at no charge. It's not open source software, so they have end user license agreement and all of that sort of stuff that has to be executed, and you can learn much more about all of that there. here is just a quick shot of the website and everybody using it. And here you have how to join, free to nonprofits. Just learn all about it there.
Hey, Terry, we have
another place for questions.
Yeah. Oh, perfect. We have a couple of questions coming in. I'll just read them out loud if that works.
Okay, great. Thank you.
We're currently utilizing a different data entry system, but want to start using REDCap. Would there be a way to easily transfer the data?
It depends a little bit, and I can definitely, for any of these questions, I'm happy to talk individually later too. But it depends. I say that because, for example, if you can get your existing data in Excel format, you can import it into REDCap. So it's not, it's not quite that simple, but it definitely can import data, which I think sounds like the way you'd want to go for that.
Yeah. Great, thanks. There's a couple more. I'll respond to a couple that are very specific. Let's see. There's one about kind of double entry for child welfare. Do they have to input their mandated in their mandated systems plus this? So essentially, just kind of asking about that integration with existing systems in communities. I don't know if you wanted to say anything about that.
Oh, yes. We do have a resource link at the end that talks all about interoperability. And I think that is probably a more technical talk than we should get into right at this moment. But again, I'm happy to do it separately and connect about that. It's hard to imagine right off the bat that it could talk to a DCF state system, but I'm not sure of that. So I'd want to look into that, closer and talk more about the particular details, I think.
Okay, great. Thanks. And that's it. That's it. Well, I'll continue to monitor and let you know if any more questions come in. Great.
Thank you. So I'll go back to our quick project in REDCap in just a second to do more of a tour around the system. And when I do switch back, we'll first look at project home and design. So we saw a little bit of it already. Project setup is there, where you can also make repeatable instruments and events. The designer, I'll show you how easy that is to use, PDFs, piping. Survey options, you all work with survey Q links for all of your cases that are enrolled in QIC, so you're familiar with that. You get notifications and automated invitations to your email, so thank you for bearing through those, but those just remind you of what all we're still expecting for cases that you entered, so it has all of that capability. And then there's a dictionary and code book as well. Actually, instead of switching back to the QIC, to the live side, I'll just show you that here. So project setup we saw and talked about a little bit, a lot of options in here. Happy to go deeper, and we'll show you some now. This is where, project setup was where you have the 8 steps, and it walks you through as you complete each one until you're ready to actually launch with real data collection. The online designer, so there are a couple of different ways to create and edit your instruments or forms, and one is through this option, the online designer. So this is very user-friendly. I'm going to get out. I said I would stay on this slide, but I decided to move back. 1 second. So here's just an example. Let me pull up a very simple one. The first thing you enter in QIC when you're submitting something. You can add fields. This is each field that's in the form, and then the different characteristics about it you can see in here. I'm actually going to pick a different one. So site, this is a very simple field. But here you can choose the different field types. Is it text box, where it's notes box, a calculated field? Here, this one is a multiple choice drop-down list, single answer. You can do all of these different things. You can do e-signature. So if people, for example, are maybe you're doing consent forms or release of information forms, you can have all of that in here, and they can e-sign. You can attach files, so you can have a copy of the ROI in here for people to be able to see while you're doing it with them. So here is where you set up everything related to your question or field that's going into your form. Is it required, yes or no? Is it an identifier? So here's, if you specify that it is, it strips them from exports. You can add a field note. All of that is covered in the online designer. You can also build it offline, your instruments, through a spreadsheet in Excel through their data dictionary format, and then upload it. So either way, but the online designer is very intuitive and pretty quick and easy. You just specify all of that. A couple look like in here and some of the features that I just talked about. So you're pretty used to seeing these. Here's the IACFD for adults in the case. It can be set up to automatically pipe in information from other forms. So I didn't enter in this form that it's Douglas and that it's a court and the referral date or one-of-one adults. I didn't enter all that here. As you've seen, it's piping in from somewhere else. And then repeatable instruments, we looked at the UA example earlier. This one can pipe in all of those earlier results so that you have it in one place to be able to look at, which is nice on any sort of like logging kind of form that you want to do. It also allows you down here to say, would you like to enter another for this case now? And you could do that and just bring you to a new form. So that's some of the capability it has around project design and setting up your instruments. It purposely keeps formatting and everything very simple because it allows you not to need a programmer or an HTML, code, a lot of complex code. So to make it fast and easy and flexible, it's pretty basic in format. So what you see here is, it can get fancier, but it basically comes like this out of the box. So you don't need to do anything to get it to look like that. So for data collection, we looked a little bit already at how to add and edit records and a record homepage. I'm going to scoot back there for just a second to show you. We did add edit records. Here is, it takes a minute. It's a little slow this morning, this afternoon. Here is a record status dashboard example. So this table just lets you see all the existing records and responses and their status for every data collection instrument that you're expecting for them. So it has a little legend for all the status icons about what status they're in. That's a quick way to be able to see what all is going on with your data. So that's in the data collection area. You can click on any of them to open the form, and then I'll just click on this one real quick and navigate to that particular form for that record. If then you fill this out, this is the next list, and you fill it out for this person, you can then say, I want to download a PDF of this survey with the saved data. You can also get a blank copy if you need it for any reason, but you can get all sorts of things downloaded into the PDF. You can watch a video about this very thing that you're trying to do. It also has the question marks. If you're needing help throughout, when you click on those, it gives you a little tip for what to do. So there's some of its instructional guidance. Record homepage, we already looked at. I'm going to show you. So this is all from the user view when you're logged in. You can also do the link. Here is one that we use. And click. So if you send this to participants that you're wanting to respond to the survey, they don't need to be logged in. They just get the link, and when they click on the link, it brings up your instrument and they're able to respond, and it all goes into the same database. So that's a different way of being able to collect it. And those screenshots are in the slides when you get them later. So I mentioned user rights and data access groups and all of those other applications related to management. There's data quality, alerts and notifications, all of those pieces. User rights I showed you, but I'm going to go to it one more time at least. Oops, sorry. Just to talk about this a little more. So here is where, say I don't put a role here, but I say CONSORTIUM. If I make Ken a user and add him with access to the site, I can then specify he can view and edit this first form. Oops, hold on a second. He can edit and view the first form, the second form, the third form, but he cannot edit any survey responses. So here's where you can get very granular, very specific about who can do what in the system. And that's really related to the security piece, so I wanted to mention it again. And then here's all about data access groups, where when you specify it this way, only users within a specific data access group can access records created by users within that group. So that's all very important to note. One more thing about reports too, because I think that's a feature that can help a lot of sites. It has this nice ability to very quickly design them, and then you can view it every day and see up to date. You can export it. You can see stats and charts. So the tool has two pre-programmed reports. If you want to view all your data, then report A is the best and quickest way. And then if you wanted to specify certain instruments on the fly, then report B is best. And then, of course, you can create your own reports. You can filter so that they only pull specific fields, records, or events. And there are lots of specifications where you can get your reports exactly like you want them. And then, of course, you can export and do more sophisticated things outside of the system in statistical packages. And here again is an example where it does some descriptive statistics, charts, etc. So I know I just ran through a lot, but as I mentioned, there are a lot of resources available to help you learn more. I'm happy to answer or talk about any questions you might have or ideas about how you think you might use it and you want to talk about it more. But some of the resources are listed here, including that second bullet, the technical overview, is the PDF that we were talking about where it talks about interoperability and how to connect to other systems. So that might be particularly helpful to review for that question. So we just have a couple more poll questions to help us learn more, and then maybe if there are any questions from the group, Ashay, we could do that as well.
Yeah, we're actually at time. I'm thinking maybe we skip over the poll questions and then just see if there are any more questions from the group. What do you think about that, Terry?
Yes, thank you. Sorry. Yes, that'd be great.
Any other questions from the group? Doesn't look like anything is coming in.
Ashay, can we do the question about next step? Any continued interest?
Sure. Yeah. Let's go back to the poll. Okay. The poll is open now.
And as you're responding to the poll, since we're out of time, I just want to thank you for your time and attention today. Hopefully we covered enough to give you a better idea about what it can do and if it's a tool that could possibly work for you. And feel free to email me. It's listed on the last slide there, and I think everybody has it already anyway. But feel free to reach out. I'm happy to answer any questions that I can.
All righty. It looks like we have about 50%, and all are saying yes. So it looks like there's a lot of interest in it. Just one other quick question that has come in. When will we have to make a decision about this? I don't think there's no deadline or timeline about making a decision. Terry, you can correct me if I'm wrong. But, throughout the rest of the grant period or project period, we can assist you with this transfer.
Definitely, and I meant to mention that there's nothing you need to do now in regards to the quick evaluation. That will continue to operate within the system, AHP system that we've been using. Nothing's going to change about that. It's more as we get towards the end, we can provide that single XML file that I talked about. We can provide that to you. Even if you haven't made a decision by that point, we can at least provide it so that if you do decide to adopt REDCap, then you could import it at any time if you wanted to.
We are running the second polling question just to get a general feel. If folks can respond to how likely is it that your site will move forward in considering REDCap. All righty. I know I'm moving quickly, but we have about, one more second, 40% have voted, and we have about 30% very likely, 50% somewhat likely, and 11% somewhat unlikely.
Great.
All right.
Thanks, everybody, for sharing. We appreciate it.
Okay, with that, I think we are done. And again, as Terry mentioned, we're here to continue the conversation either with us or with your ELs or CLs. Just let us know how we can help. Again, thank you, Terry, for hosting and presenting the material, and thank you, everybody, for joining us. We'll talk to you all soon. Thanks.
Thank you, everyone. Have a great day.